Ventilators are breathing apparatuses that support healthy lung function. They can assist you with your breathing when you're receiving treatment for or recovering from a disease or health condition. Ventilators pump air into the lungs to support breathing. In some cases, this is referred to as a vent or breathing machine. People who cannot breathe on their own need a ventilator. This could be because they are under general anesthesia or have an illness that affects their breathing. Ventilators are available in a variety of types, each of which provides varying levels of support. The type a doctor chooses will depend on the patient's condition. Whether they are used in hospitals or ambulances, ventilators play an important role in saving lives. It is also possible to use them at home if someone needs long-term ventilation. Who needs a ventilator? When a person is suffering from respiratory failure, ventilation is required. In this situation, a person cannot get enough oxygen and can't expel carbon dioxide properly. This can be a life-threatening condition. Many injuries and conditions can cause respiratory failure. These including head injury, stroke, lung disease, spinal cord injury, polio, sudden cardiac arrest, neonatal respiratory distress syndrome, acute respiratory distress syndrome, ARDS, pneumonia, or sepsis. Some people with COVID-19 have severe difficulty breathing. In addition, doctors also use ventilators for people who undergo surgery and will not be able to breathe on their own due to anesthesia. What are the different types of ventilators? There are several types of ventilators based on the ways a person can receive ventilator support. These include face mask ventilators, mechanical ventilators, manual resuscitator bags, and tracheostomy ventilators. Let's look at each of these ventilator types in detail. Face mask ventilator. A face mask ventilator is a non-invasive way to support someone's ability to breathe and get enough oxygen in their blood. A person uses one by wearing a mask that covers their mouth and nose and allows air to flow into their airways and lungs. People with COVID-19 may use a face mask ventilator if they are having difficulty breathing or do not have sufficient oxygen levels. Continuous positive airway pressure, CPAP, and bi-level positive airway pressure, BiPAP, devices also operate via a face mask. People often use these for chronic conditions, such as chronic obstructive pulmonary disease, but some doctors may also use them for people with COVID-19. Mechanical ventilator. Mechanical ventilators are machines that take over the breathing process entirely. Doctors use these when a person cannot breathe on their own. Mechanical ventilators work via a tube in a person's throat, pumping air into the lungs and transporting carbon dioxide away. People with COVID-19 may need a mechanical ventilator if they are critically ill. Manual resuscitator bags. Manual resuscitator bags allow people to control the airflow of their ventilator with their hands. These devices consist of an empty bag, or bladder, that a person squeezes to pump air into the lungs. A person can attach one of these devices to a face mask ventilator, or, if they are intubated, a doctor can attach one to the tube in their throat. This can be useful as a temporary solution if a person on a mechanical ventilator needs to stop using it. For example, if there is a power outage, a person can use a manual resuscitator bag while waiting for the power to come back on. Tracheostomy ventilator. People who have undergone a tracheostomy will require a ventilator. Tracheostomy is a procedure where a doctor creates an opening in the windpipe and inserts a tube, which allows air to flow in and out. This enables a person to breathe without using their nose or mouth. For related articles and updates, look at the description below. We hope you found this video useful. Please like and subscribe to keep connected. Thank you.